I think I was diagnosed in 2007 with TMJ. I was suffering from tremendous jaw pain on my right-hand side, and they gave me a mouth guard, and I was in a very stressful position at the time, and then once the position was over, it sort of dissipated to a certain extent. I was religious about wearing the night guard. And then in the year 2010, I started noticing problems with photosensitivity in my left eye and having chronic headaches every day, and other joint aches, lower back pain, and then the eye problem became more profound, and went from doctor to doctor to doctor, starting with ophthalmology, where they said I had severe dry eye syndrome, and then after going to Houston and different doctors, specialists around the country in Canada, I come from Canada, finding that there was a huge disconnect between ophthalmology and neurology, and finally I was told I had dystonia. I had blepharospasms of the eyes. So they would inject Botox into the upper eyelids and above the eyebrows, and it was so tense they could barely get the needles into the upper brow and even into the soft tissue underneath the eyes. Even with the Botox, I had very minimal relief. When I talk, my eyes tend to be more open. When I'm listening, my eyes are almost completely closed. I do drive a car, and days when I'm really bad, I won't drive it. I can drive with sort of one eye, or I will do tricks. I listen to music and sing along, so when I'm talking, I can actually keep my eyes open. And then I've found these videos and read more about this TMJ connection, and thought this was worth looking into. And I'd even gone to the Mayo Clinic and talked to a neurologist there, and they had said that this was worth researching. And now that I've researched it more, I totally believe there is a connection between the TMJ, because when you do have the mouth guard, and there's less of a special orthopedic device that you put in, it helps with the sensation and the desire to close your eyes. So I'm quite hopeful and optimistic that this is going to improve the quality of my life, and have a lot of the pain dissipate. And if a perk is that my eyes are open more of the time, then that is well worth having had this journey.
What are some of the pains that you have?
I've had some jaw pain, headaches, profound headaches that are almost like migraines, temporal, both bilateral temporal and at the back of my head, where I'm taking Advil every day, and a bit of neck and shoulder pain, achiness. I'll use a magic bag and I'll warm it up in a microwave oven and put it on my shoulders, just to get my whole shoulders to relax. But I am a type A personality, and I know that I grind and tense up, and I can feel the tension and that pain going from my inner ear all the way up to these temporal lobes here. So, and the lower back pain, I'm not sure if that's connected to this, but it's definitely an imbalance there. Whether I have very poor posture, I do tend to slouch, but that's could be a part of this. But certainly I think that the jaw alignment is key to what's going on here, and that it's off.
Okay. Thank you. So this is pretty normal when you're just sitting there, the eyes are pretty much closed?
Mm-hmm. I can try to force them open. It's a strain. If I'm concentrating on a task, it's easier to keep them open. If I'm sewing, sometimes reading a magazine, I can sometimes keep them open. But it depends on how relaxed I are and what time of day it is. This fluorescent lighting is terrible. I can't go into stores with fluorescent lights. I have to really acclimatize myself to that. I'll wear sunglasses. I even have moisture goggles with a band of foam so the wind doesn't come in, which is part of the dry eye syndrome. But it's a struggle. It's a daily struggle.
Okay. Okay. Go ahead and put the mouthpiece in that I just handed to you. Okay, take it out for a second. I just want to see.
There we go. That's the transition.
Okay, go ahead and put it in.
My eyes are open when I'm not talking.
Look up to the light.
That's fluorescent lighting.
That's fluorescent.
Yeah.
You've had the acupuncture too, where they couldn't get the needles into.
Acupuncture for TMJ, where it was so tight they couldn't get the needles in. They were popping out.
What do you think?
Well, it's like a different person. It's a different person. Can't wait to see the other effects over the next few days. See what kind of changes happen here. It's pretty miraculous.
What are you feeling right now as we adjusted the mouthpiece and just put it in?
It's going to be a bit of an adjustment to get used to it, but that's minor in comparison to the pain that I've endured. I'm really hoping to not have headaches that are debilitating every single day. I've been swatted into the menopause kind of. I also have Hashimoto's arthritis, so everything's been thrown into those different catch-alls, and so I think this is a definite connection between this. If I can keep my eyes open, I'll improve the quality of my life, and if the pain will dissipate, that will also enhance my quality. About a day and a half since I've had my hard device in, and it's been a remarkable change. I'm noticing that my eyes are much better and improved, and I can see. In fact, my eyes are open so much that if I were dry, I had to use more drops because my eyes have not been used to being open that much, and they were actually bloodshot at the end of the day. But I did notice that when wearing the nighttime guards, I woke up 2 mornings in a row now, no pain in my fingers and my joints, my arms, my elbows, my shoulders, pain-free. No, I have not required any Advil, and it's renewed the quality of my life already in a day and a half. I'm noticing a change. It is a minor adjustment getting used to the mouth guard, but well, we're all worth the benefits of it. You just have to get used to that little bit of a lisp initially, but other than that, it's quite the trade-off for some improved quality of your life.